Hello guys, this is Indian Medico and in this video we are going to discuss about Lipaemia retinalis. Lipaemia retinalis is a rare manifestation of hypertriglyceridemia manifested by abnormal appearance of retinal vessels and occasionally the entire fundus. In Lipaemia retinalis, there is creamy white discoloration of retinal blood vessels as you can see in this picture. In mild cases, only the peripheral retinal vessels are affected, and in extreme cases of Lipaemia retinalis, the entire fundus takes on a salmon color. Coming to the pathology in Lipaemia retinalis, visualization of high levels of chylomicrons in blood vessels accounts for the fundal appearance in Lipaemia retinalis. Coming to the clinical features, visual acuity is usually normal, but electroretinogram amplitude may be decreased in some cases of Lipaemia retinalis. Coming to the treatment of Lipaemia retinalis, we have to correct the underlying hypertriglyceridemia. Once triglyceride levels return to normal, the ocular findings resolve. Thank you.